Welcome to our AI segment where I share safe and helpful ways you can start using generative AI at your surgery center today. The following examples don't include any PHI or pose any data risks to you at all, so you should feel very comfortable getting started. In today's example, we're going to use Chat GPT to create a custom GPT. First, what is it? If you're like me, maybe 6 months ago, I didn't know what it was either. So you're certainly not alone. GPT stands for Generative Pre-trained Transformer. Yes, it sounds like an action figure. I can definitely envision like a GPT to the rescue cartoon who's just going around answering everyone's questions all day. But anyway, a custom GPT is like having a highly knowledgeable assistant that you've trained completely, and they can help you with very specific tasks, questions, or anything you need based on your specific information. So when you use ChatGPT or any AI tool, it pulls information from everywhere and looks through what we can call general knowledge. But a custom GPT is tailored specifically to you. So you can upload your own documents, data, and rules for teaching purposes, such as your ASC's policies, patient data, schedules, financial reports, and then ask it questions or request help based on that information alone. And creating a custom GPT is extremely easy. You do not need any tech experience, anything like that. The only kicker is that you do need to have the paid version of ChatGPT in order to create a custom one, but it's only $21.95, I think, per month, and it's totally worth it. So here are the steps to do, and I'll also include them in the episode notes if you want to follow along, but they're super simple. So go to ChatGPT and log in. In the sidebar, you'll click Explore. You can then click the black Create button that's in the top right corner, and then click the Configure tab. And then this is really where the work comes in. So you're going to enter your what's called instructions and upload all of your documents. Now, in the scenarios I give coming up next, it'll tell you what documents you should be uploading for each of the three custom GPTs I'm going to walk you through. But in this case, you would upload any of the data, spreadsheets, CSV files, whatever you have. Click Save, click Confirm. Super simple. The hardest part is just gathering the data and all of the documents you want to upload, but actually creating the GPT takes a few minutes. So now that you have those basic steps to create a custom GPT, here are 3 different use cases. Scenario number 1. Let's talk about your policies and procedures. How many times have you had to go digging through your policies and procedures trying to find an answer for either yourself, maybe a new staff member, maybe a surveyor who came by unexpected, or a physician? Using a custom GPT can save you a ton of time. So all you have to do is upload your policies and procedures, then use AI as this on-demand assistant for your team to answer any questions you have. And you can also, even if you create one, you can share your custom GPT with other users as well. So your staff can use it as much as they need to as well. So staff can ask questions about compliance, regulatory requirements, specific protocols without having to manually flip through pages to get the answer. It could definitely help with training new employees by providing step-by-step guidance and answering kind of those what if scenarios. So, for example, a nurse could ask, what is our process for reporting a patient safety incident? What are our guidelines for patient consent before surgery? What's the policy for storing patient records after discharge? The options are really endless, and you'll immediately get an accurate answer. I love this scenario. I can picture a ton of examples where it would come in handy. You can also use it to update your policies and procedures if you need to. Let's say you go from paper-based charting to implementing an EMR. You can use Chat GPT to help you update the policies as well. Now, of course, you want to review them very closely, but hopefully you're getting the vision here for all the scenarios where you can have digital access to your policies and procedures and not only be able to search for the section you want, but get answers to the questions you have as well. All right, scenario number 2. So 2 weeks ago, I did a segment all about how you can use AI to help you analyze data and predict trends at your surgery center. Now, those scenarios that I gave were using the general chat GPT and not a custom one. So this kind of takes it one step further. You can still analyze data and predict trends, but this time it's in your own custom GPT. So in this case, you would upload all of your historical data. So maybe you can get into a routine of uploading your data every 30 to 60 days so that your custom GPT is always up to date. And then you could use it to analyze key operational metrics in seconds, like billing cycles, case cancellations, physician productivity. It could also provide insights into optimizing these metrics or spotting patterns that are maybe leading to delays or issues. And then you can even set up alerts for data anomalies if you wanted to as well. So after you upload all your data, you could ask a few questions. Here's just some examples. What are the 3 most common reasons for case cancellations in the last quarter? Which payers have the longest payment delays? Which surgeons consistently have the shortest case times for knee replacements? What is the correlation between case volume and staffing levels? There are tons of different scenarios. Now, what you can do, let's say you didn't want to use the custom GPT to do this, you can absolutely use the generic one or the general one to upload a spreadsheet and ask specific questions. But what the benefit of having the custom GPT is that it's going to have all of this historical data for you as well. So instead of just looking at a snapshot of one spreadsheet that you just uploaded today, it's going to go and look at all of your historical trends as well. And of course, it's specific to you and the scenarios it gives, the physicians it talks about, it's all going to be just your surgery center. So really endless possibilities there in terms of analyzing historical data as well. And then scenario number 3 is similar to the above one, but a little more niche. So you can create a custom GPT just for your patient satisfaction survey results, or even your OAS CAPS results if you wanted to. So same thing, let's say every 30 or 60 days, you upload the results from your surveys. So you're building over time. This could really help you get ahead of any downward trends that might not be glaringly obvious. So a few examples of questions you could ask. What are the top 3 most common complaints from patients this quarter? Or if you were the administrator, which area would you focus on improving next? Or has there been an improvement in wait time satisfaction scores since we implemented the new scheduling system in June? Or based on the past 12 months of data, what is the predicted patient satisfaction score for next quarter? And with all of these 3 scenarios, so the policies and procedures, the data, and then the patient satisfaction survey results, I could also see a world where these come in handy when a surveyor drops by unexpectedly, or maybe you're in a board meeting. Imagine a physician asks you a question you weren't anticipating, such as, what days of the week are ORs most underutilized? Or how do satisfaction scores vary between morning and afternoon surgeries? Or what's our policy on overtime for clinical staff? Anything that might come up. If you have this custom GPT set up, you can pull it up right then and there and answer her questions immediately. So there you have it, 3 ways that AI can help you today. And if you try any of these, please let me know in the comments. I would love to hear more use cases or things that you've learned along the way.